and pickleball have become popular as spring sports, and they are arriving once again, which also means a rise in injuries. The team at Illinois Bone and Joint Institute say not only can they help fix the injury, they can help strengthen the patient to prevent problems in the future.
This is a really popular time for people to be picking up new sports. Two of the most popular ones right now are paddle tennis and pickleball. These are games that have been around for a long time, but they've been very popular in about the past 3 years, and they're essentially variations on tennis. They are played with a little bit of modification to the balls, and so it makes the game a little bit more accessible to people of all ages. And you'll see that they're so popular that many parks and playgrounds have now added courts specific to these, and many local rec centers have done the same. Especially as people start new activities, we often see injuries coming out when they're starting something and not sort of used to how their body is going to perform. I always recommend that people make a routine so that they can best understand how their body is going to perform on a given day. Personally, for me, I think that stretching is helpful, but you know, there's people who go either ways on it, but I think it's one of the things that helps you have a good understanding of what the reliability is that your body's going to give you on a certain day.
Push, 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 and then bring your toes down to the floor like you're pressing the gas.
It's almost daily or weekly that we're seeing someone who participates in these kind of activities. Often it's common injuries like ankle sprains, quad or hamstring sprains. And often those can resolve with some conservative treatment on your own, but there's some more serious injuries too. Things like Achilles tears or meniscal injuries, cartilage injuries in the knee or the hip. It's not something you often can plan for because you'll go for that last ball and then you'll find yourself in trouble and a little bit of discomfort. I usually tell people that you should always try doing some conservative therapy on your own unless you have a few situations. One where you have very severe pain, or if you're having difficulty weight bearing, or if things don't respond to some conservative therapy after a couple of days. And that's things like gradual return to activity and relative rest, things like Tylenol, or ibuprofen or naproxen, and then some icing, elevation. If things don't quickly respond after a few days, then I think you should get checked out.
Any numbness, tingling in your feet or toes?
One of the great things about if you've had an injury is with the Illinois Bone and Joint Institute, there's 13 locations that do same-day visits. They're called our ortho-axis visits, and you'll see an orthopedic specialist to help you sort these things out. We go through a stepwise evaluation process, and that begins with what happened, how did we get here, and that often can tell you a good deal of what you need to know. And then from there, most commonly we'll obtain some imaging studies the same day, including x-rays, and those are very helpful to rule out a few serious things like fractures. They also let us know if you have any significant arthritis or what are considered degenerative changes in a joint. And then, you know, physical exam to actually evaluate the joint and see what the motion is, what the strength is, and what is affected. And from there, we put all those things together and then come up with a treatment plan. In general, we're trying to speed up the process to get people back because in this day and age, everything is instant. It's important to be active, and we want to see people getting out this time of year.
All right, if you'd like some more information about Illinois Bone and Joint Institute, call the number on your screen or head to its website, IBJI.com.